watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of facial plastic surgery. My first guest is a board-certified plastic surgeon, and we've invited Dr. Michael Sundine on the program today to discuss the keys to a natural-looking facelift. Dr. Sundine, welcome to the program.
Well, thank you for having us.
Now, before we get into today's topic, and I see you brought some photos,
Yes.
Tell us a little bit about your practice. I guess you do everything, not
Yes.
just facelifts.
Yes, we're a full-service plastic surgery practice, and by that I mean we comprehensively do everything, both cosmetically and also for reconstructive procedures. And we will do facial rejuvenation, including brow lifts, upper and lower lid blepharoplasty, face and neck lifts. I have a very keen interest in rhinoplasty and nasal aesthetics. We also do body contouring, breast surgery.
So you do liposuction, tummy tuck. What about fillers, things like that?
Absolutely. We do fillers, we do laser rejuvenation, hair removal laser, vascular lasers. So we really try to offer the full spectrum of plastic surgery services for our patients.
You are also the head of plastic surgery at the Orange County Children's Hospital. What's your role there?
I'm very involved in the treatment of kids, especially with craniofacial anomalies. So children with cleft lip, cleft palates, hemifacial microsomia, where one side of their face is smaller than the other. Craniosynostosis, which is a condition where the sutures of their skull fuse early, and several different syndromal conditions.
I mean, you rebuild faces.
Correct.
In certain cases.
Yes.
With these kids. How does that make you, by the way, a better plastic surgeon? I mean, today we're talking about, facelifting.
Right.
Does it make you better?
I think it does. And one of the things I think it does is it draws your eye, and you learn, I think, to pay keen attention to details. And when you have something so asymmetrical, so different, that you're just trying to restore it to normal, I think it gives you a nice eye and perception for how to deal with an aging face and how to reposition things back to where they were normal. And I think that eye for detail is key. Same thing in a cleft lip, where 1 millimeter difference makes a huge difference in how that lip repair looks. That 1 millimeter makes all the subtle difference in position of an eyelid, position of a brow. And so I think that keen eye for detail, obviously being anatomically in the same area, it was really important.
Now, you've done a fellowship in maxillofacial surgery or craniofacial surgery. What exactly does that mean?
It's kind of together. It's craniomaxillofacial, and essentially what it is treatment of the skeleton of the face, essentially from the top of the head to the jaw. And so it involved procedures both of the skull and reshaping the skull, involving the eye sockets and sometimes even moving or rearranging the eye sockets, to deformities of the jaw and face where we may need to move the upper and lower jaws forward in combination, maybe within whole segments of the face.
Okay, now your practice is in Newport Beach.
Correct.
By Fashion Island.
Yes.
So now who's your typical patient going in for facelifts these days? What are the age ranges? Who's doing it?
Age range is really remarkable. I've seen patients as young as 38 who need a facelift, who've come in and have some really stigmata of aging, with jowling, with drooping of the corners of their mouth, sagging of the skin and soft tissues off their cheekbones, to up to 70, 75 years old.
Are the patients getting younger and younger, older and older in your practice, that are getting facelifts or facial?
I think the answer is both. I've seen some patients who come in their late 30s and they need something done. And many times the patients who previously would have never considered facial surgery, I think with the increased popularity of plastic surgery and maybe more exposure to it, are starting to come to our office and consider things that they maybe never would have before.
Now, we talked on the telephone. You said that you've trained in one of the best facelifters in the world.
Yes, I did. I've spent postgraduate training with Dr. Bruce Cannell, who I believe really is one of the leaders in facelifting. And
what defines a good facelift, by the way, in your eyes? One you can't notice, one that looks natural?
Yeah, both of those actually. Okay. I think the key is really to restore a patient back to appearance when they looked younger. I don't think a good facelift should alter your appearance. It shouldn't look tight. It should look like they were more youthful. They should be, hopefully, look 15 to 20 years younger after following that procedure without visible stigmata from a facelift.
Now, I always say on my show, and our show airs nationwide, and we interview all types of doctors, even in Canada now, and I say I could spot a good facelift 20 yards away.
A good facelift or a bad facelift?
A good facelift. I feel like I have an eye for it. Are you saying that's not a good facelift? If you can spot it?
If you can spot it, it's not a good facelift.
Okay.
It should be a natural-looking facelift. And what you should see when you're walking down the beach or walking down the street, you should say, "Wow, she looks good," or "He looks good," and they look youthful, they look refreshed, they look restored.
Now, men and women, still more women getting facelifts than men?
I still think yes, more women than men.
And what is that percentage in your practice?
I would say it's about 70 to 30%.
70. Would you like to see more men in there?
I would. I think men are coming more and more to facelifting. I think a little bit different reasons, but I think more and more men are interested in getting these things done. And again, the stigmata of having cosmetic surgery is going away.
Now, what's wrong with aging gracefully?
There's nothing wrong with aging gracefully. But now, if you want, you can do something about it, and you have that choice that you can restore yourself and be back to it. It's certainly a choice that you can make.
So as a plastic surgeon, I mean, what's really changed in the world of plastic surgery that makes, I mean, are you that much better at getting a natural result now than you were 20 years ago?
Yes,
are you convinced of that?
Yeah, absolutely.
And why?
Yeah, I think there have been several things. I think we have a better focus and understanding of what was involved in the aging face in terms of what's happening with the tissues, both at the skin level and in the deep tissues of the face. And I think the advent of technologies has really helped, and those have been wonderful adjuncts.
It's like Botox and fillers.
Botox, fillers, structural fat grafting.
You have Fraxel, you use Fraxel as well.
We use Fraxel, and all of those things help really bring a whole comprehensive approach to treatment for facial aging.
You say in the old days it was more of a skin pull.
Yes.
Is that true?
Yes, absolutely. And
so the training was skin, pull skin.
Yes, and it really wasn't until the early mid-1970s that really people began to address the deep layers of the face.
Let's begin with how you look at the aging face. Patient goes to you, let's say 45 plus, whatever. They don't like the way they're aging. What goes on in your mind?
Well, first I want to know what their concerns are, because they will certainly come in and say, you know, my eyes bother me. Or
do they say that? They just come right out and say this will bother me?
They come and say, and they'll say, or I look angry, or I look tired, or I look old, or I hate my neck. And or I hate these jowls, or these folds are too deep. And so certainly those are things that they commonly present with. And then we'll kind of go from there, and I'll give them an analysis of their face. And I try not to focus just on the areas that they've concerned, but I want to start from
So you got to tell them what you see, how you see it.
I'll tell them, and even if you come in and just say, my eyes bother me, I'm going to say, I'll tell you the whole picture from top to bottom. Then we can decide what a good plan is. And maybe it's just your eyes, but it might be something else.
Now you say some people come in, they think, and they're very sophisticated today, you say. They come in, they say, I need a facelift, and really all they need is maybe some volume or fillers or laser. Is that really true?
Yes, absolutely.
Because as a surgeon, I always think that you're thinking of plastic surgery.
Well, and that's why it's good to have a comprehensive practice where you have more tools than just a facelift. The person who needs filler, or who just has, is maybe in early, or mid-30s, who just needs maybe their crow's feet taken care of with a little Botox, or someone who needs just a little filler just to even out some wrinkles, who clearly doesn't have the significant changes associated with aging, that they're going to need a facelift.
All right.
Not everybody needs a facelift.
All right, now you say you brought a photo that really best describes the aging face.
Yeah, so I brought a picture here of a patient who really typifies the aging changes that we see in the face. This lady came to us. She's in the beauty industry. She really is interested in looking better. She feels she looks old, tired, a lot of concerns about her neck. So Rainey, I want you to look at a couple things. First is her concern, and look at the jowls on her. And what she's really has happened in the typical aging face becomes boxy. We lose that nice heart-shaped face of youth, and we get boxy.
So jowls are starting to fall. It happens to everybody, you say.
It happens to everybody.
Okay.
And we get more angular as we get older. We get a hard look. And basically what we see is that the soft tissues that used to live up on our cheekbones have fallen off. It's gotten hard. It's gotten, and you can call it a skeletonization of aging.
So the underlying tissues you're saying have dropped?
They have.
Are they muscles?
Sagged.
Are they fat? What is it?
The muscles really haven't changed because her smile hasn't gotten longer. It's more the tissues above the muscles but below the skin. And it's began to sag, and it loses its elasticity, and so it sags. And it basically sags inferiorly, so down, and medially, so towards this crease. And that's why all of a sudden she gets this hard angular look over her cheekbones, and this area, the nasolabial fold, fills up. Because that tissue that used to live up here over your cheekbone has now fallen off your cheek.
Why not just put a filler and avoid a facelift altogether in those nasolabial folds?
Right. Well, you can certainly fill them up, and you'll see them to be less visible, and they'll not draw your attention as much, but it really still hasn't treated her problem. Her problem is her tissues have sagged down to this fixed point, the nasolabial fold.
So that's what's causing the crease.
That's what's causing the crease.
This
is dropped down, and this is a relatively fixed point that things are just falling over the top of.
All right.
It's kind of like a landslide over a fence.